Woo, that seat was hot today. The nation's top health officials under intense microscope today. Dr. Anthony Fauci, CDC Director Rochelle Walensky, both testifying before the Senate Health Committee on the federal COVID response and why the public should continue to trust our major institutions and those two. Despite poor communication, mixed messaging, seemingly inconsistent public health guidance, the list is long. Here's Senator Patty Murray questioning Walensky on the CDC abruptly changing its isolation recommendations.
I appreciate the background, but I just want to know, straightforward, if someone is exposed to or has COVID-19 and they're vaccinated, what do they do?
If they are exposed to COVID-19 and they are completely boosted, they do not need to stay home, but they should get a test at day 5.
What about unvaccinated?
Same for unvaccinated for isolation. So isolation being those who have had disease.
What? I mean, is it me, Emily?
Yeah,
the same thing. I mean, okay.
Yeah, exactly, Harris. And I thought, there was an incredible, so many tense moments, frankly, especially between Dr. Fauci and Senator Rand Paul. I thought there was a lot of finger pointing going on, a lot of accusations of stoking criticism in the media that led to unhealthy discussions about policy attacks on a personal level rather than discussing the policy's truth and these officials' accountability for such, Harris.
Well, and all of that aside, I want to go back to, though, what she just said, Kayleigh. I mean, you're talking to millions of people now, not just the room, right? Know the room, that's fine. But the bigger room is out here, all the peeps. That didn't make any sense. Was that useful, what she said? And isn't testing the thing? Don't we want to understand?
Yeah, absolutely. And we were promised testing, but not given it because the Biden administration dropped the ball. There's so much, I think you hit on a really important point, Harris, so much mixed messaging. The CDC guidelines, a great example, reducing the isolation time and then saying, but you don't need to test at the end, even if you might still have viral load that you're spewing to infect others. And then getting severe pushback, getting viral internet memes over your CDC guidance, having the CDC director admitting it wasn't all based on science, only to then come back and revise the guidelines to say, oh, well, if you can find a test, yeah, you should probably test after 5 days. We are at a really, really dangerous point in this country when Axios a few days ago had an article called The Biden Administration's Credibility Crisis. And it was saying, look, half the country doesn't have faith in President Biden. I'm paraphrasing here. But when you stop trusting public health officials, that's when we have a problem. And we've gotten to that point when they're still using the term the pandemic of the unvaccinated. One example of many. There is such lack of faith in the messengers coming out of this White House. We need new faces, and we need credible faces.
Well, and you know that I lean hard on, well, who are these unvaccinated people? And if you want to make it about politics, then you're not seeing all of the blacks, Hispanics, and others who, for many reasons that Dr. Siegel and I went into last hour, don't trust the government, don't trust the vaccine. I mean, how come the government doesn't talk about them and shoring them up since they're identifying them as people who need more and first treatment? Carly, there was a moment in all of that when this morning, when Dr. Fauci was asked about treatments, and he did talk about, some of them, although there are a lot of questions about why we don't see them readily available to doctors. And when you do ask for Paxlovid, for example, you're asked what the race of the patient is. That's an aside. But when Fauci was asked about treatments, he talked about awards. Take a watch.
What's the current status of NIH research to better understand long COVID, to look at symptoms and potential treatments?
There have been a number of awards that have been given. Most recently in September, there was an additional $470 million funding supported through the American Rescue Plan, engaging about 100 researchers from 30 institutions.
I asked our team to pull that out because it just felt like a huge pivot. Carly.
Yes, because it was. And the Biden administration and the health officials, Dr. Rochelle Walensky and Dr. Fauci, they always pivot to talking about vaccines and away from treatments. And that's a really big problem. It was huge news when everybody found out that the Biden administration was prioritizing giving COVID treatments to people based on race. obviously racist. You need to treat people based on their condition and not on the color of their skin. But the other issue with that is that we shouldn't be rationing treatment at all. I mean, this country should have enough treatments.
You should have prioritized that.
Without a doubt. And it is a failing on the
everybody.
Biden administration to not have that at this point. Operation Warp Speed for treatments needs to happen.
Yeah, I don't know, Juan. My mind was just blown when he pivoted to award-winning performances by himself and others. You've got to be joking me. It is not time for a victory lap. It's time to save some people's lives, if they can do it.
I agree. I think this, the messaging has been muddled, especially on this latest episode about how long to quarantine and whether or not you need a test. I don't think there's any question that they are dealing with an evolving problem here. I mean, we have a once-in-a-generational challenge in terms of this, pandemic, but they've got to be clearer. Now, there's no argument, though, about the success and the efficacy of vaccination and the booster. Everybody agrees. Our hospital system would not be strained, overloaded, like a quarter of the hospitals in the country at max capacity right now, and people having to cancel surgeries for cancer and other illnesses if people were vaccinated. I mean, it's a simple thing, and I don't think we can argue about CDC messaging, but there's been no questioning about that or about the use of masks. And remember, this goes back. This is nonpartisan. This goes back to arguments
I hear
under
all
Trump
of what you're
about
saying.
masks and
but
about
you know what you're really
vaccinations.
saying,
There's
Juan?
nothing here.
You're saying that this current administration has come up with nothing to help us go forward since President Trump's Operation Warp Speed's vaccines. That's what that drills down to. And if you want to say it differently, if you want to change the facts on that, you got to call the White House and tell them to do something better. Build back better in the category of COVID. We got to go.
The facts stand pretty clear that, you know what, we have vaccinations today and we have testing available, and that's the key.
Thanks to Trump.
Oh, my goodness. And you really think that Biden came up with those vaccines? Please say it before we go to commercial so you don't get tweeted into the next quadrant of the universe.
The distribution has been under President Biden, and he has made it available, and we have gotten, I think it's now,
He's convinced people not to take it to the point where black communities are suffering for that, so he wants to make up the difference on the back end by prioritizing their care. We could go on, but we only have an hour.
No.
A Pulitzer
Well, you
Prize
have
winning...
subsets of people who are not vaccinated, and you have to help all of us.
All right. Okay, we're in it together. I hear you. I'm committed to get to this commercial.